Welcome to Concussion Podcast, episode 109. I am talking to Dr. David Kensell, who is the Director of Pediatric Rehabilitation at Mount Sinai. He's also a professor at Rehabilitation and Performance at the Icahn School of Medicine at Mount Sinai. He's also a ringside physician at many of the combat sports. So we have a lot to talk about. And but first, I'd like to thank my sponsor, HeadCheck Health.
Concussion Talk podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more.
Okay, so thank you very much, Dr. Kensell. And we were talking briefly before this, and I kind of cut us off so we could start recording. But yes, I guess first, you're saying you wanted to talk about the one thing we noticed about children is the buy-in, and I kind of want to, to root that is just how would you define concussion to your, because not kids, but this part of their parents more. And would you bring up brain injury because concussion, is a brain injury, and that's often, I think, maybe one of the reasons why people don't want to talk about concussion associated brain injury, because they don't want to think of it as a brain injury, but it is obviously. So how would you describe, if someone came to you, how would you first describe them, what you're going to do, and what your exact role is going to be?
Well, Nick, thank you for having me. And that's a great question, because it is one of the things that I try not to tiptoe around when I'm speaking with the parents about this.
Yeah.
Because I think it's really important that the parents understand that it is a form of a brain injury.
Yeah.
Sometimes the parents have this conception that they get in sports of, well, they got dinged, they took a hit, and they don't quite realize that it is a form of a brain injury. And it's one of the first things I say is that it's a concussion. And sometimes we think of it as someone just, taking a hit and getting dinged a bit, but it's called a mild traumatic brain injury, but it's still a brain injury. And getting the buy-in from the parents is really important, because when you're talking about, kids, especially teenagers, it's going to be very difficult for them to adhere to any kind of regimen or protocols that I try to set without the parents buying in. That's across all aspects of pediatric care.
Right. Yes, exactly. So what exactly is your role at Mount Sinai as director of the pediatric rehabilitation?
Well, I see all sorts of musculoskeletal conditions. So I would see kids, for example, anything from tennis elbow to muscular dystrophies, genetic conditions. I see, newborn babies, perhaps that may have, just a flat head, what they call plagiocephaly, just they were laying on their head and their back of their head's flat. Or I can see a young adult who either has a brain injury or perhaps has a disability like cerebral palsy, and they're just older. And certainly it goes across the life spectrum. When I was in training, the oldest person that I saw in a pediatric rehab clinic was about 54 years old, post-polio.
Really? Oh, from childhood? Is that because they had polio in childhood?
Mm-hmm. And one thing that we often find is that it's hard for someone who has any kind of, I would call it being different. Anybody who's different, as you go from being a kid and going through becoming an adult, what we find is that it's hard to relate to general practitioners, regular pediatricians, regular medical doctors, especially when you go from being a kid to going to adult care. And so a lot of times the one person that they see constantly, the one constant that they have is the rehab doctor. And so a lot of times they stay with the rehab doctor because that's the person who knows their difficulties, their troubles, kind of understands them in a way that other doctors might not.
Yeah. So are you a physiatrist? Is that what you describe yourself? Your training?
Yeah, we call ourselves physiatrists. It sounds a lot like psychiatrists,
Yeah.
and some people call them physiotherapists. And so I like to call myself a rehab doctor. And so I see musculoskeletal medicine, and I do everything from treating kids with, Botox injections because they have tightness and tone, to seeing, kids who have aches and sprains, back pain in kids.
And obviously, this is one of the areas of your expertise, but just tell us just examples. I know because obviously I had spasticity after my brain injury, but what is spasticity? Spasticity.
Spasticity is technically called velocity-dependent increase in muscle tone. We have these. It's a mouthful, right?
Yeah.
What it means essentially is that we all have these built-in stretch receptors in our body. If we straighten out our arm, we have local receptors that tell us, hey, listen, don't overdo it. Don't overstretch your arm because you might injure it.
Right.
And so these protective mechanisms help us in how we move. So if I straighten my arm out, those stretch receptors send a signal to my brain that tells me what's going on. My brain can override that and say, don't worry, don't tighten up, relax, you're just straightening your arm out. If I move it too quickly, my brain is able to override that local signal. But when you have a brain injury or even a spinal cord injury, you're not able to either generate that signal or send that signal to those local receptors to calm them down and tell them not to fire off and get tight. And so what happens is if you move the arm very slowly, you can get a full range. But when you move quickly, those stretch receptors activate and make you tighter, stiffer. And then you're able to kind of loosen the person up slowly by moving them. So that's part of what spasticity entails.
So it can lead to increased spasticity, can lead to just over the extent and you like I've done that before. And I continue now because it's a hot day, but I'm stretching on my arm. But you can like kind of almost hurt, but feels kind of range. It gets hurt discomfort when you do your arm too quickly. Now let's say you're looking at my arm, but I'm 18 years past my injury, so my right arm's good too.
No, you're right. What can happen is that it depends on which muscle is the one that's tightening. But usually when we're straightening our arm out, our triceps in the back of the arm activate to extend that elbow. The biceps has to relax and let us stretch. If we have issues with spasticity, those stretch receptors, are firing off, not letting us straighten the arm out. Our brain says, hey, listen, don't worry about it. Let it go.
Yeah.
But if you don't have that signal, then you're going to get tight and stiff. And in some cases, especially really severe brain injury, it can actually be painful. The person can complain of painful muscle spasms. Right. And that's how they interpret it, as like a spasm and a tightening that can be painful.
Okay. That makes sense to me, at least for someone who's experienced that. And I also just want to get back to just the kids for a second. For just a second, for a while. They had do you notice that they're more injured? Not young kids, young like below say 5 or it's different type of brain like their frequency of injury and stuff like that. But say school age kids, you find that there's a certain time of year that's more. You see more concussion, more brain injury.
Well, certainly there is this bimodal distribution of times when people have injuries and ages when people have injuries.
Yeah.
And certainly we know that teenagers tend to be a little bit more predisposed to those things. But certainly we do look at the summer months when people are out and about more. When you're talking about seasonal sports, then it actually coincides with the type of sport, what part of the world you're in. Certainly in Canada, it would be during hockey season.
Yeah.
So you might see an uptick in that. For us, it would be, for sports related during football season.
Yeah. And you're in Mount Sinai, New York City. Mm-hmm. So obviously the hockey is similar and it's not similar, but like it's still probably more people playing there. But anyway, a lot of people playing football. But also the winter now, this will come out on the 14th of December. So in a week, when you're listening to this, in a week it'll be winter officially, and the holiday season. So did you find more incidents then of brain injury concussions of people slipping on ice, or is it just more general or just generally injuries, just the same ever, just sort of across the board for injuries?
You mean like I think a lot of times what happens is that in the warmer weather, people are out more,
Yeah.
more so than in the colder weather.
Yeah.
In the colder weather, it might be more people horsing around, playing around,
Yeah.
might be more sports related, versus the summertime when people might be riding a bicycle, being, playing outside, just being more active and being out and about. And so that's usually going to be the more likely reason why you might have an uptick in the warmer months versus the colder months where people are mostly indoors and it might be more sports related.
So do you ever say anything to parents or kids, I guess, a certain age, when for over the holiday season or the winter season, that they should be careful of if there's a just shoveling more or just outside in their steps and stuff like that? But I mean, I know you could say don't just ever be careful, but I mean, I would just think that with the ground, it's more icier, then you're obviously gonna for falls but there's no linkage necessarily linkage there between the more ice, the more slippery conditions and concussion or brain drain kids.
I couldn't say that I see more of that because of it. I actually tend to see it more in the younger kids because they're playing in school.
Yeah.
They're indoors.
Yeah.
And they might be in a more enclosed environment.
Yeah.
And so as much as I might think, oh, they're outside and they might be at a risk to slip, they're indoors and they're roughhousing and playing indoors, and then they bang into a wall.
Outside, yeah. Right. Because it's no good outside, they're indoors, and that's when they bang into lockers and slip on the wax floor or the wash floor or whatever. But yeah. And also want to talk with your ringside position. So what it says in your bio, it says in your state combative sports. What is it? So what do you are a ringside physician? What does that entail? What does that mean? Like, where do you actually practice your ringside physician stuff?
So I'm a physician member of USA Boxing. That's the organization that's responsible for the typical Golden Gloves events that you think of when you think of people trying to compete in the national and trying to move their way to the Olympic level. So I'll cover some bouts in New York City, for example, or in the local area. And in general, this covers kids of all ages, maybe 10, 11 years old, up until, the adulthood. Actually, we get, adults and older individuals competing. Part of my job is to do a pre-fight assessment, see the fighter, check for any kind of injuries that they may have going into a fight. Someone may, for example, may have a fractured bone in their face, maybe in the hand. Observe them during the fight, sitting at ringside, and then observing for any signs that the person may have any kind of an impairment in their ability to defend themselves. And that could be that the person might actually have a concussion, or may have another muscle injury, maybe even an injured shoulder, an injured hand, but certainly intervening if necessary before it reaches a point where it's dangerous. And the interesting thing about being a ringside physician in sports compared to any other sport is that being a ringside physician, you're the one person or the one type of doctor that can actually prevent an injury from happening. Most of us, when we go to a sideline sports, a hockey game, a football game, an American football game, you're on the sidelines, right? The person gets hurt and then you see them. Right. Ringside sports is the one time that you can actually intervene before that person can seriously get hurt. And so that's the one thing about this particular type of contact sport that makes it different. I can look at someone and I can see their eyes as they're fighting. And I can tell you who's just physically exhausted versus who's not in the fight, who's really not focused. I can even tell you if a fighter is fearful just from the way they move in the ring. And part of it comes from my background of having different kinds of training, but certainly you can see it in the fighter and try, if you're able to warn them or let them know or even intervene if necessary.
Well, so I was going to ask you, is that just from, like you see it, obviously watch the first last you, is it just boxing or do you do also MMA and martial arts as well?
Yes, practice it, and then also covering those events, kickboxing events, MMA events, and so being in grappling events, and so having an understanding of that of any sport. If you have an understanding of hockey and the intricacies of how someone moves about on the ice, how someone actually controls a puck, that allows you to have a better sense of when someone's not doing what they're supposed to be
That
doing,
makes sense. Yeah, totally. Yeah,
or for example, missing a defensive assignment. You
yeah.
know that this player is supposed to be at this particular position or supposed to be reacting in a certain way, and you can see they're a little bit off in their reaction time. I see the same thing when I'm seeing a fighter. I'm looking at a fighter and seeing in between rounds when that fighter is engaged. I look at their eyes and seeing, are they looking at their trainer? Are they looking at their coach? Are they engaged and following and strategizing in between rounds? If they're not paying attention, if they're looking at the ground, that's letting me know something's off. Maybe they're hurt. Maybe they might even not want to fight anymore. Maybe they're just tired. But I do look at that because once that bell goes and they're back in the ring, you can see someone trying to plan and trying to strategize and moving about the ring in a certain way that lets you know that they're actually still engaged in that match versus someone who doesn't quite seem to be fully engaged.
Okay, that's true. Because yeah, what you were saying, like, because the examples you're talking about are kind of the missing event assignment or not moving about the ring and not watching what they should be watching if they're engaged in the fight. Does that depend more on your experience in general, or is it more athlete fighter specific depth? Is it just a general idea that normally this fighter or this athlete will be here, will be doing this, whereas if they're an athlete, you say, well, this athlete doesn't normally do that. Are they not advanced enough, or they're just that's the way they are? Does it matter personality wise?
It's actually a little both.
Yeah.
What I tend to do is when I do the pre-fight exams, I ask them how many bouts have they had, and if they're new to the sport or they haven't had many bouts, you can expect them to perhaps not be as polished in the ring. So you can expect that they might be, we call a little wild in the ring, like they're just kind of not understanding the nuances of movement and angular movement. You don't just go in a straight line. You attack at angles, 45-degree angles, circling your opponent. That's strategy, that's movement. With a newer fighter, that may not be the case, but you'll still see the expression on their face and how they're trying to move and trying to figure out or guess what their opponent's trying to do. As they get more and more skilled, they'll be better defensively, where they can better able to protect themselves against any strikes, and also how they're approaching or trying to gain some offensive advantage. So it's a little bit of both. You're able to look at them and see, but I often look at their face more so than even their body, because that lets me know, are they engaged? Are they really looking at their opponent versus they're not quite as focused? They seem to be, moving away from their opponent, not wanting to engage. We don't call it running away, but certainly moving away and not engaging.
So is it mostly in the face? Is it mostly the eyes, or is it just certain areas of the face are tighter or more just more tense?
It's almost, think of it almost as if you're when you're in a conversation with someone and you're
Yeah.
face to face, you're generally having eye contact, you're engaging.
Yeah.
When you're in a bout, what you're doing is you're looking at your opponent, and depending on the sport, kickboxing, for example, you can kick, you can punch. But certainly when you're looking at the person, you're looking about and seeing the person as a whole, trying to see where that attack is coming from, trying to anticipate that. So it's a mental chess game. And so you really have to be sharp when you're doing that and really focused and hyper-focused on what's going on in that ring. If I notice that the fighter isn't defending themselves intelligently, their hands aren't up when they're in a fighting position, they tend to just duck and dodge and just kind of move away. That's letting myself know, and also the referee know, the person in the ring know that they may not be defending themselves in an intelligent manner, or perhaps in a manner that's conducive to a bout.
So do you ever ref do you ref any of these matches, or have you ever, or do you simply do the physician ringside physician?
I'm usually at the ringside. There are referees that are in the ring that are also trained and are aware when a fighter, and usually these are ex-fighters, and so they're aware, and they can also see, and they can be my eyes and ears in the ring. Being in one particular corner means that I may not see something, but the referee inside might be able to. And I tend to be very mobile. I will literally get up and walk around to the other side of the ring, or walk around to get a better look at the fighter.
So the second two-part question is, if have you ever, or not have you ever, it's not one example, but do you often find that you say to an athlete, there's something off here, I don't think you should continue, and secondly, if they say no, they'll say no, I'm fine, I'll go back in, and it's ultimately their choice, or whatever, I guess, kind of. And then has the ref ever come to you, the trained ref ever do, said, the fighter's not looking too good, he's doing this, and then you'll say, I agree, and then you'll tell the athlete, and they're like, no, that's just because I'm just feeling a bit, that's fine now.
Yeah, that's a good point, because almost all cases, the fighter will say, no, I'm good.
Yeah.
Yeah, I have stopped bouts, and I often will actually get information from the referee, who will say, can you check out so-and-so in between rounds? Or they'll stop the bout for a moment and have me check on the fighter. And yes, we do sometimes have to stop bouts. And this is where that nexus between seeing the fighter and knowing about what they do and how they do something, whether in any sport. One that I remember very well was a young man who would drop his left hand anytime he entered into an exchange with his opponent. And he was doing it in the first round. And we could all, at least those of us who were ringside, could clearly see that he would drop his hand and he would catch a hook from his opponent because of it. And it happened repeatedly. And he would get a standing 8 count. And we kept thinking, okay, in between rounds, if he continues to drop that hand, this fight will not go 3 rounds, and we'll probably wind up stopping it. And sure enough, whatever they coached him in his corner, I'm not sure if he followed it or not, but that hand kept dropping and he kept getting standing 8 counts. And so when they did it again, I actually just stood up and stopped the bout, because we had reached that stage where he was a young guy, maybe 16, 17 years old. Mm-hmm. He was very upset and he was yelling at me, well, this is my career. And I said, yeah, but your brain is more important.
Yeah, and you're 16 years old. It's not your career yet.
No, his coach was angry too, and that's the thing, is that you're gonna get heat from everybody. From the fighter, the coach.
Are you hired by the commission? Is that the deal? Like the New York State Combat Sport Commission or whatever, Boxing USA Boxing hires you, or do certain teams, groups of, like, do they hire you? Who pays you if there's best?
Well, there's a group of physicians who are physician members of USA Boxing. Yeah. And when they do have the events, they ask us, hey, do you want to cover some of these bouts? Oh, so for the Golden Gloves event, they will ask us, do any of you guys want to compete, or say be at the competition and be there? And so we will say, yes, we could do this event, that event, if it's close to where we live. And then they'll try to fit us into a place that's closer to where we are.
Okay. So you say you've covered more than just, you say kickboxing, boxing, some MMA, some martial arts maybe, but which sport do you think that you cover at least, and which sports do you cover? Do you find it's most say you would stop the fight more often, or you would notice that there's more prevalence of concussion symptoms at least?
Kickboxing.
Kickboxing?
Simply because there are more striking points. When you think about the human body, we don't ever think about striking with our elbows or our knees. Yeah. But those elbows are actually one of the strongest parts of your body. And when fighters are in a clinch, in other words, they're holding each other, it's very common especially at the higher levels, to drive an elbow upwards into your opponent or sideways. And so when you sometimes miss that because you may be at a different angle, but certainly because there are more limbs that can strike, it creates many more opportunities for someone to get injured. And so I actually find that as much as I would think it would be boxing, because you're using your hands and you're punching, it's oftentimes because you can kick and you can deliver elbows that the kickboxing.
Right. Okay, the elbows. Yeah, didn't know you could first and you could lever elbows. I'm sure in this fighting sports and like MMA as well as some martial arts sports too. But there's I've seen maybe not as many competitors, or you don't see as many bouts with those athletes. But so what I've looked at questions about generally about fighting the glass jaw. Like I've noticed the odd time. Like I'm not a fighter, so I don't get hit in the face. But then there's a part of in your jaw that's a bit is there a nerve or something that's there that you hit there, you do get a bit woozy or maybe dizzy. Is that true? Is there a part of there? Is there a nerve or
we do have the facial nerve that exits out here.
Your trigeminal?
Your trigeminal comes out here. The facial nerve is around here. So certainly there are nerves there that can be injured. Often I would be thinking of the mastoid process here that may be more likely to an injury.
Yeah.
And so that might be where
your chin bone.
Yeah. That might be it.
Okay. So that's when people say the glass jaw, it's not necessarily down here where I'm thinking. It's that down at the bottom of your jaw, it's maybe up near your ear more.
Well, I think glass jaw also is kind of a catch-all term, because you may not necessarily have a jaw that's necessarily thinner or more predisposed. It may just be that for some people, their bony structure may better be able to absorb some of those forces. Whether, and I know what you mean. You're thinking, hey, there are some guys who can take a punch better than others.
Yeah.
And what I've noticed is in the more experienced fighters, and this just happens just a few, last weekend, we had an MMA bout. The very first, the moment the fight started, 3 seconds in, the more experienced boxer or fighter who was a boxer got hit and went right down. But the thing is that he had done about 20 or 30 boxing matches. And so he had the wits about him to be able to kind of recover very quickly. So quickly, in fact, that his opponent never had a chance to capitalize on that. And so in the more experienced fighters, they can sometimes hide the injury. They can sometimes mask that injury. And so it's a little tougher with the more experienced fighters, because when they get dizzy, they get rocked, they're better able to move about in the ring in a way that makes it harder to tell if they had an injury. And at times I'll have to wait until in between rounds to really get a look at the fighter and see how they're engaged and whether they're engaged in between rounds.
And this is maybe more it's hockey related, but maybe more anything. I actually played hockey myself, but so have you ever been on not ringside, but rink side at a hockey game and seeing the players like fight obviously there? Did you ever notice that there's someone obviously has concussion while they're fighting a fight in a game?
No, I haven't. I've seen hockey, live, and it's for those people who have not seen hockey live, it is so much faster than you expect when you see it on television. So I can imagine just, eating a puck, although you have something covering your face. But no, I haven't seen that. And I think that when you have those fights, sometimes, when the guys drop gloves, I think it also depends on where they strike. I think for the most part, a lot of times those guys really aren't landing blows exactly where you'd expect them to be.
Yeah, they're not trained fighters. They're just experienced fighters. But they're also on skates. Yeah. So what you said you participated in either boxing, MMA, or martial arts. What combative sports did you participate in?
Well, like when I was in high school, I learned how to wrestle in the amateur style.
Okay. How's that different? You mean just like as opposed to like these like Hulk Hogan and like The
Yeah,
Rock and
exactly.
John Cena and all them. Yeah.
Although I do cover professional wrestling bouts as well, and those can actually be, dangerous in and of themselves
Yeah.
when
Actually,
something goes
I had
wrong.
on Rob Van Dam was on my podcast in episode 48, 40, no, not 48, but 40 something. And he has the documentary about being concussed and being injured. And yeah, sorry, don't interrupt
Mhm.
you there.
No, 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 absolutely. And I've seen, his matches, and certainly what he does is high risk. And so,
Yes.
when you deal with anybody in any kind of particular sport or style, there is always that risk. I That's what I first learned. Then, much later, I learned boxing, and then Taekwondo, and then Jujitsu. And so, as you kind of move from style to style, you notice the commonalities in all these different things, but also it allows you to get a sense of just the level of impact with any particular style. And so certainly in a similar vein, when you look at a sport, like let's say football, you understand that certain positions carry higher risk than others. The linemen, for example, the head impact that they have throughout a game is a lot more, it may not be noticeable to the fan, but certainly if you're watching the amount of collisions that they have, yeah,
Yeah.
and you can see that.
Right. Because I know, because jiu-jitsu is more grappling to the style than a lot of the taekwondo is less so than say boxing, kickboxing. But is that true? Is that more grappling than
Yes, and that's
wrestling?
in a sense because you are doing a lot more joint locks, but you still do throws. And so usually when you throw and you're working with a partner, you're being considerate of your partner.
Yeah.
So you may throw them in a certain way that will minimize the impact. And of course, you learn how to take a fall, meaning you learn how to spread out the force when you land.
Which
But
I learned by travel fire. But yeah.
Yeah, but it does. Have you taken jujitsu?
No, but I mean like falling. I just fall a lot. Well, I don't anymore, but I used to like when I after my age is from learning to walk, I fell a lot and just scare you. The physician, my physio always said to me, you're such a graceful faller. But it's just because
that can save you from many a broken bone, and you learn how to fall. And so one of the very first things they teach you in any style of anything is how to be safe, how to land properly, so that when you are with a partner, whatever you're learning, that you will do it in a safe way. And so certainly with jujitsu, they teach you how to fall so that if you are thrown, you learn how to control yourself, whether you're in the air or whether you're landing, to be as safe as you can be.
right. Okay, that makes sense. And so I guess we're gonna move away from the combat sports now, but to finally because I've been on the phone now for a while, but online. But you're associate, you're a professor at the Icahn School of Medicine. So what is, first of all, for those listening, people in Canada or not in New York City who not know what the Icahn School of Medicine is, and it's at Mount Sinai. So what is it, and what do you teach?
Well, Mount Sinai is a health system here in this area with them in the New York regional area.
Yeah.
Although they have branches outside of the New York City area.
Okay.
And so there's an associated medical school. It's actually literally across the street from where I am.
Okay.
And so for us, we will have students rotating with us during some of our clinical responsibilities. Sometimes we'll do lectures for the students. Sometimes we'll have them rotating through with us. And so we may even see them helping us with research. For example, with Dr. Petrino at the Abilities Research Center here, right. Students may want to engage in research here, and certainly even in some of the things we do in the community. I had a medical student maybe about 3 or 4 weeks ago do a kickboxing event with me. There were a few of us that went residents in training. And so the students kind of learn what they're able to, some of the elements of a physical exam, pre-fight exam, post-fight exam, what to look for, things that they might do in the clinical setting.
Okay, actually, as soon as you said that, I wanted to jump back to combat sports again. So how do you conduct a not pre-fight, post-fight, pre-fight, but during exam, during ringside exam? How do you perform those?
So we always go from head to toe. It's easier to remember. So a lot of times, the very first thing you do is you check eye movements. You check and see if there's any abnormal eye movement when you're checking the slow movements, the pupillary response, for example.
Yeah.
To also check. You would also look inside the ears as well. Some fighters, not always, but some fighters may have injuries inside the ear, the eardrum, ruptured eardrum, for example.
Yeah.
You would check I often say to the fighter, okay, now I'm going to check your forehead, cheekbones, jawbones to see and assess for any fractures, any orbital fractures, any maxillary or mandibular injuries. Then I'm going to check your collarbone. I don't call it clavicle. Nobody knows what that is.
Yes.
So I'm going to check your collarbone to check, because for certain sports like kickboxing, an axe kick which comes across the body might break that collarbone. And so you check for anything like that. You check the center of the chest for the sternum, and then the ribs for any rib fractures or hairline fractures that they may be trying to hide. You check the hands. Some fighters may have broken fingers or metacarpal bones, the ones before the fingers, and also fractures along the forearm, elbows as well, and then the knees. And then I'll have them, kind of like squat and walk for me to just test their strength. And then afterwards, I may do a little bit more abbreviated version, just checking the main areas where they were striking. It depends on the type of combat sport, but certainly something that you want to be able to do. And we kind of herd them in. We, at the beginning of a bout or an event, we do like, 25, 30, different fighters. And so we kind of bring them all one after another and do their exams.
Yeah. Right. And so that's it's a lot of work, but a lot of stuff to remember for every athlete, which I've written down. But during a match, during a bout, so someone comes ringside during a bout, during a match, and they look like they're just a regular fight, it's going well, both scoring well or badly, both sides, but nothing egregious. How would you approach an athlete doing an exam on an athlete at the corner?
You mean after the bout?
Sorry, during like between rounds.
Between rounds, we really don't check the fighters unless we're called up into the ringside, onto the ring apron by the referee. But what I will do sometimes, if I'm concerned about a fighter, is I will get up and leave and walk around to where that fighter is, just to get a closer look at that particular fighter.
Okay, so you just checking, constantly watching, obviously, and just to see how they're doing. And you go. Do you only go up when you're alerted, or do you say to a trainer, say, hey, this guy is not, or this woman is not doing this properly, and is that normal, or do you chat with them, or they just expect them to say, oh no, that's fine, he or she is fine? Do you expect that? No,
there's actually a protocol for that. Depending upon the rules of the commission, if I, as a physician, step onto the ring apron to assess that fighter, that may actually end the bout. And so, because they may say, well, the physician's stopping it to check on the fighter. So what I have to do is understand the rules of that particular combat sport. And I may request the referee, hey, can I check on so-and-so and such when they're done and just before the next round starts. And so in those cases, I'll actually assess the fighter very briefly right before they're about to start the next round. In fact, I made the mistake once early on of being concerned and checking on a fighter at the end of a round. And one of the referees, who was much more experienced with me, actually said to me, he said, just so you know, doc, just, in between rounds, that's when they're getting their coaching. And so in a close fight, you may have cost the fighter his bout because he wasn't getting coaching while I was checking him. Right. I should have instead waited for that to end, the in between round time to end, and then assessed him. That wouldn't have penalized him. So there is a protocol that you have to follow so that you don't adversely affect the outcome of a bout.
Okay, well, that certainly covers my questions for that. But I'm jumping back now, because my listeners confused now, but jump back to the Icahn School of Medicine. So do you, as a physiatrist, as the director of the rehabilitation unit, even pediatric rehabilitation unit, do you also do all the work with, like, do you work with the physiotherapists themselves? Jenna, just like just in June, Jenna Tosto was on here. Jenna Tosto Mancuso was on here, and the Abilities Research Center. Do you work with them? Is that your unit? Is that your director? Is that what you're for? Like, do you work for them, with them exactly, or do you direct them?
I work with them, and in fact, one of the things that we do is we have the Play Safe initiative. So we have a concussion clinic here at Mount Sinai, and we also have a Play Safe initiative created by Dr. David Petrino. And so he runs the Abilities Research Center. And so one of the things that we do is the Play Safe initiative, which is where we partner with local high schools, and we'll do pre-fight exams. So we'll have a whole herd of kids come in before their season starts. Some of the rehab sports medicine fellows will actually do pre-season assessments that we can use and compare if there's a concussion or an injury, so that when I see them in the clinic area, either at the Abilities Research Center or in my clinic, we have a baseline to compare with. And so what they actually do is they'll use like an app called Sway. It's a cell phone app. You literally put it on your chest and you kind of do balance testing. And the cell phone
like Apple, like I know my mom, like the Sway thing for a car, for like Toyotas, for example.
Yeah.
Driving, switching lanes, like something like that. Yeah.
It can read that movement. And so you get a baseline, and then you can compare that with balance testing to see if there's a difference. And then the other one that we want to use is a device called Neurocheck. It's a head goggles. And what it does is it actually works on visual evoked potentials. It's kind of like an EEG, but a portable one. And what it does is it flashes lights in your eyes that are read by your eyes. And the signals are sent to the back of your head, where our visual receptors or our cortex is. And so what it does is it reads how we're interpreting those signals, or the way the signals are being read and sent to the back of the brain, so that it actually gives you a readout and comparing it to what a normal response would be. You get a baseline before their season starts. And then if there's an injury, you can actually have them try it out and see, is there a difference between what happened after this injury compared to their earlier baseline assessments. And so we do everything.
So do you think baseline assessments are very important, or just somewhat important, or great to have, but not necessarily?
I think that in any sport, if you're able to do even the smallest of a baseline, it can help someone like myself when I see the person and I don't have a reference or a baseline. At least I have a value that lets me compare something to. Obviously, we know that sometimes people will try to, get out of or give me responses that may not be legitimate because they don't want their concussed results to be any different.
Right.
But I think it's actually really important because it allows me to get a sense of what this person was like before. Sometimes when I'm seeing a kid in a clinic, I will ask the parent, is your child typically behaving like this? With children, you will often get some behavioral changes. They don't really know what's going on, especially the young ones. They're a little bit more short-tempered, maybe what we call labile, sometimes they get moody, and it's hard to tell, especially with a teenager, whether it's a moody teenager versus a kid who's really having a hard time with loud sounds, with, maybe it's a family that's very verbose or vocal, but now the kid can't handle that because it's just too much information and brain overload. And so knowing those things can help me. And so if I can have that information, before they get their injury, it will certainly let me know when they've come back to their baseline, or at least they're close to it.
I think I honestly think I could have you on like all day just asking you questions about this, because obviously it's an area which is very important to me and very like fundamental to how I am now and what I look at and what I learn and stuff. So, but I was going to ask you about you're associate professor. So is there a specific? You say you go with to three residents to combat sports matches to ringside nuts and stuff like that, but ringside assessments. But do you teach? Do you teach anything as professor? What is your area you teach?
You know, when you come in as a doctor, they call you an assistant professor, and then you kind of get promoted to an associate professor, and then you become a full professor. It's kind of this nebulous, kind of hard to define title, but
I should know that.
No. I don't think anybody knows that, not even us.
No, but I'm a teaching patient of standardized patients at their local med school. So I know, and they just kind of, they obviously teach their areas of expertise, but they kind of teach everything within their area of expertise, which is what you would do, obviously.
Well, they kind of look at it from the professor perspective as there are different types of professors. So there's a research professor, someone who may do a lot of investigational work. Maybe they might be doing a lot of studies. And then there are actually clinical professors who teach by examining patients, doing clinical work. And that's actually been, up until coming here to Mount Sinai, was what I was doing, more clinical work. And now I'm kind of moving into doing some more research. But certainly there's a clinical track where your experience, your ability to teach others how to examine a patient, what are the clinical findings you should look for, doing lectures and presentations, teaching people the fundamentals of what to do. For example, I work teaching injections, for example, for people who have spasticity and tone, injections to the muscles, but also other things, and teaching about new medications, new medicines for, genetic disorders like spinal muscular atrophy or Duchenne's muscular dystrophy. So, it's a range of things that we cover as pediatric rehab doctors. So part of it is teaching those things.
Well, that's just this is that's exactly. I wanted to give you the last word, but thank you so much. And about just generally, what would you tell kids about it? Also, well, two parts really. First, what would you tell kids / parents about concussions / brain injury, and any new? I guess you said you're moving into research. So anything new that any new research you find? Do you think you're doing that? Do you think is very interesting, such as spasticity, injections for spasticity?
Well, certainly, I think when it comes to speaking with parents about concussion, it's important to let the parents know that a concussion can occur from any blow to the body, not just the head. And so we always have to look at it as an event in which there was an injury to the brain, but it could have happened with the person not even being hit in the head. I think also that it's not just, getting hit in the head and getting dinged, that it is a form of brain injury. And there are treatments that you can use. Some are more conservative than others, but certainly that when you're entering into sport, you want to be able to play the sport, whatever it is, whether it's combat sports or football or hockey, that you want to make sure that you play it in the safest way possible so that you can get the most out of the sport. And in terms of new things moving forward, I think certainly here at Mount Sinai, building a concussion clinic, but also being able to use those new technologies so that we can bring them to the field, to the sideline, to the ringside, to actually be able to test kids so that we can get a sense of what's going on with them and better treat them.
Thanks. And where can people follow you? Not you, but you or the Medicine School of Medicine or Mount Sinai or the U.S. boxing or the ring, any of the other sports you do ringside position for. Where can they follow you online or find you online to find information about that?
I think that the best would be actually reaching out to Concussion at mountsinai.org. So that,
and know that. So, and who gets those emails?
Well, that would be the Abilities Research Center.
Okay.
So that we can that way we can actually, if we have anyone that needs to speak with us or wants some information from us or wants to reach out to us, they can certainly reach us that way. I think that's probably the way that our whole team would be able to be involved. This is a concussion treatment management is a team process. And whether it's, the doctors, the therapists, the teachers, the coaches, even the community, it's all kind of a group. And so certainly starting from that and moving forward, I think would be a good recommendation.
Okay, well, beautiful. Thank you so much. That is an excellent recommendation. And I just want to thank you so much. But first, but just let you know that I was to talk to you for a second after I begin this podcast. But for everyone else, thank you so much for listening. And thank you, Dr. Cancel, for your amazing advice and your amazing expertise. So thank you all for listening, and hope you stay in soon.
Thank you for having me.
The music at the beginning of this podcast is by Ben Sound, www.bensound.com.